Well, certainly the healthcare sector has battled through the last 3 years of the pandemic. It's most likely an industry that has had to make many pivots, but hopefully will be much better off as we move ahead. And one of the big components of that future growth of healthcare, something we've seen already, but continues to grow, is technology and digital health. To talk about all of that, we welcome back Ezekiel Emanuel, who is professor of healthcare management at the Wharton School, as well as professor of medical ethics and health policy at the Perelman School of Medicine at the University of Pennsylvania. Zeke, always great to talk with you, and hope things are going well for you.
It's always great to be here. Thank you.
Where do you think we are right now in terms of the healthcare sector, especially when you look at what all of it has had to go through over the last 3 years?
It's very stressed. Let me just raise first, we have a big labor problem because of all the burnout. It's been an intense 3 years. We already had some challenges, and COVID didn't make it any easier. A large part of those challenges, relate to doctors and nurses' sense of autonomy, sense of social connection, and they're feeling very challenged. Some of the polls have 60 to so percent of both nurses and doctors burned out. So there's a huge labor problem, and replacing the people who've left. There's estimated 300,000 nurses, for example, have left the profession. You've got hospitals, including hospitals right here in Philadelphia, that have new wings or new hospitals and can't staff them. So that's a challenge. Second, you've got hospitals that are having financial challenges. A lot of hospitals reporting operating deficits. Forget the investment deficits. They made big investments in the market and other vehicles. And obviously 2022 was a loss year. But there's a lot of them with operating deficits. That's because they lost a lot of the elective surgery during COVID. And it hasn't come back. Some of it was definitely unnecessary. And I think it's showing the bad business model that many of them had living on elective surgery. And that, I think, is another major challenge. If there's a positive, there are answers. So one thing I think you're seeing and going to see much more of is automation. I've written about this in the Wall Street Journal, and I think it's really, really fundamental, which is, you're not going to solve shortages of workers by throwing workers at them. So you need automation where it can work, whether it's in scheduling or patient intake or other, getting them information or automating prescription renewals. Getting 90-day prescriptions. There's a lot of automation that can happen. I'll just tell you, I'm working with the natural language processing company, and we talked to the cancer center. One of their big challenges is they don't have enough people looking at their patients and reporting them to the registry. They're 2 years behind. So if we had technology, automation that could go through the records, fill out those forms and report them, holy cow, that would make it, you wouldn't need so many people, and it would make it very efficient. So I think those are the kinds of, automation is coming, like many other things. Healthcare is slow in adopting that tech, but I think the pressure because of labor shortage is going to be high to adopt said automation. I think another very clear area is, everyone talks about RPM, remote patient monitoring. That is wrong. Remote patient monitoring is useless. It's what we need is remote patient management. The issue is you find out some patient, because of remote patient monitoring, because of a bunch of sensors that can be installed passively, i.e. the patient doesn't have to download an app and this and that. It works behind the scenes. Then it has to go to some central processing area. Can't involve the doctor or the nurse to sort through the noise and the signal. You need AI infused, to soup up tremendously the signal to noise ratio. But then the question is, what do you do? You know, and we need better experiences with either a telemedicine visit, a home visit, you're really sick, you need to come to the doctor's office or to the emergency room or to an urgent care center. I think that's coming, and you're going to have a lot more home care of this type that'll allow us to decant hospitals that are running at 100% capacity, but also much more cost effectively treat patients. And I don't know anyone who's been in the hospital recently who was like, oh yeah, I'd rather be in the hospital than my home. I've never heard that. Never, ever heard that. So, most patients would prefer to be treated at home in a, environment they know, an environment where they can sleep in their bed, not disrupted at 2 a.m. by a nurse taking their blood pressure for no obvious medical reason. Anyway, I think those are two big trends: automation and remote patient management / hospital at home, more acute care at home.
So then is this really, and we've used the term pivot a lot during the pandemic, and obviously businesses have had to pivot, to be able to survive. Is this kind of the pivot moment for healthcare, having experienced all of these outcomes and impacts over the last 3 years, and now knowing where it has to go? And what all you talked about right there seems like that's going to be a process that's going to occur over the next several years to be able to get us to the point where we need to be.
You're 100% right. It's the next several years. It's not just tomorrow or the whole rest of the year. That's the first thing. The second thing, as we learned with telemedicine, part of the advances that were able to occur rapidly were able to occur because of regulatory suspension. Right? You suspended rules that were impeding, like cross-state line malpractice, across state line reimbursement, across state line licensure of doctors. We need that kind of regulatory relief, I think, in many areas of healthcare. I do think it wouldn't be a go amiss if the secretary would appoint a blue ribbon commission and say, oh, on that, this regulation needs to either be pared back to this number of people, or we could suspend it altogether. A lot of that pressure is coming on telemedicine, but it's a lot of other areas, as you point out, and that would make these pivots to automation and home care, like more extensive use of home care, much more common.
Well, then it puts even more emphasis from a policy perspective on addressing these, or starting to address these issues here in the very near future, because of the length of time that it's going to take to kind of implement them.
You said it better than I could. Absolutely. And I do think having a group that says, we should suspend these, a lot of regulations come in for a reason, but they often are responses to a particular case. And then they're broadly written, and it's like, oh man, you've imposed this regulation that is, we understand where it comes from, but it's probably making more paperwork and impeding innovation that could occur.
Joined by Ezekiel Emanuel, professor of healthcare management here at the Wharton School. So we were talking a little bit about the different elements of digital, and when you think about the benefits that it has had already on the day-to-day management and connection between patients and medical personnel, but there's also the research side, and how much that technology is playing a role in building out a lot of what we are trying to fight against on the medical side.
Yes. One of the challenges in medicine is that new technologies raise costs and don't lower costs. I am very, very on the lookout. I've seen a few for new technologies that actually can lower costs. I'll give you one example. Full disclosure, I'm an advisor to this company, and I'm really excited about it, and which is why I'm an advisor to them. And that is, here at Penn, we developed CAR T therapy. We pioneered it, and it's where we take cells, reprogram them to fight cancer and now potentially other conditions. But manufacturing, they're all bespoke. You've got to take them out of one patient, infuse them, change them, infuse them. That production is very labor intensive, and it's all bespoke. And one of the things, when humans get in and pipette from this to this and all the steps that are necessary, growing them up and decanting, first of all, takes time, labor intensive, and because it's human step to step, potential mistakes and variation can happen. So they're working on a technology that will automate that process. And once human puts in the cells, the only other thing they do is take the cells out, and every single step is automated. And this is estimated could reduce the cost of manufacturing CAR T cells from $160,000 to $80,000. Still not cheap, but that's a big delta, a very big delta. And so I'm very excited about that possibility. Having technologies like that can lower the cost of care going to be really, really important. I think the system is, employers through a variety of mechanisms have said 18% of GDP, that's our limit. And I think they're going to enforce that. They can't pay more. We're in a situation where health insurance now $22,000 for a family. $22,000?
Yeah.
Well, you can buy a car for that. So I think we're going to have new technologies that actually succeed in lowering costs.
Are you then positive or optimistic or maybe even a little pessimistic about the kind of growth of tech companies that have wanted to be in the healthcare sector, thinking the Amazons and some of the other ones that are having their, trying to have their impact, and what they think they can bring from tech into healthcare to help kind of manage part of the process?
Well, I'm skeptical. And the main reason I'm skeptical, and Amazon may be an exception for a reason I'll tell you, is companies like Google, they're in love with their tech. They're tech people in love with tech. And healthcare is fundamentally not a tech. Tech enables healthcare, but it's not fundamentally tech. And you're not selling ads. You're selling human interaction to solve problems. And that is not a tech problem, and you need to understand the system. And one of the reasons I think they fail over and over again is they're too in love with their tech without thinking through how people are going to interact with the system. Now, what's different about Amazon? It's very much a consumer-facing platform that isn't really a tech. I mean, yes, there's a tech platform back there, but that's not its fundamental thing. It's got how do we anticipate how people are going to interact? How do we take advantage of that to streamline it? Those are the things that are important. And Amazon, the other thing it's very good at is taking failure and using that failure to fix products, right? Many people will remember Amazon Fire, total failure. Yeah. Didn't go away, right?
Yeah.
Came back. Not as Fire, but in other products that they did, Alexa and other things. So you gotta, I think that's one reason I might be a little more optimistic about Amazon. Nonetheless, healthcare is hard. Understanding the health marketplace is hard. And I'm a little skeptical that companies are going to solve problems. The other thing is, from an employer standpoint, you have to remember that concentration and market share really matter to get providers to change practices. And not that many employers have big market share in a market that they can push the providers to actually do things differently. So that makes me a little more somber about possibilities.
But when you talk about tech in general, I think that the discussion in a lot of sectors is, we're building up the knowledge and the understanding of how tech can impact so many different business segments right now. Is it safe to say that a lot of the focus that younger generations will also have a benefit as they get, a little bit older in their life with all these different business sectors, that to a degree they will also benefit on the healthcare side from all of this technology that could be involved in the next, say, 10, 15 years?
Well, Dan, maybe you have a clearer crystal ball, but 10 or 15 years is hard for me. I would say I agree with you. One of the things we're going through is a big teething phase now. And I do think, tech that doesn't work so well is going to get weeded out, and tech that works well is going to be expanded and improved upon. And I do see that coming down the pike. It's like, what is home care? It's a big logistical problem. You got to get all these things, whether it's antibiotics, IV fluids, hospital bed, oxygen, all to get to the house at the same time, to be set up easily, not inconvenience the that's a huge logistical challenge. It's a very big tech challenge. And I think getting that right is something that's going to have to be worked on. And there's no doubt a tech platform is going to be necessary for it, and is going to make life a much better. But it's not here today.
So let me then take the 10 to 15 years component out of play, and let me just focus next year, because part of this is us looking at what next year. What is it that you would like to see healthcare in general address next year, in the next 12 months, that maybe is something that's maybe lower hanging fruit, that's more attainable? Are there elements that you focus on out there that you would like to see addressed?
I do think the adoption of automation is going to be really critical. I mean, I just don't know how we're going to get through this labor shortage problem without adoption of automation. That's the first thing. And I do think the next 12 months could be critical, where people experience real savings and real benefits and see its advantages. Second, I do think over the next, one of the things I'd like to do is outside, I'd like the employers to get serious about their approach to healthcare. There are things employers can do. And I think the biggest one is, in a market, a city like Philadelphia, could you do a better job of coordinating your benefits so you don't have 1,000 plans by insurers? You have a standardized plan that everyone's buying. And we know from other countries that works and we know from the California Exchange that works really well. Well, we're going to have a standardized plan with standardized deductibles and copays, with standardized pricing. And if you did that, you would decrease a lot of fragmentation. And it's not like, these employers have been deluding themselves that, they manipulate these things just a little and they'll have a competitive advantage on healthcare. We've seen that as a failed experiment going for decades. Standardization is way better. They know that in their prime business. They should know that in healthcare, and they should begin to insist on it. And you can't have standardization unless the employers get together.
Zeke, always great to talk to you about all of these things. Thanks for giving us a few moments.
Take care, Dan. It's been a pleasure.
Always great to have you. Ezekiel Emanuel, professor of healthcare management at the Wharton School and professor of medical ethics and health policy at the Perelman School here at the University of Pennsylvania.